Hi, everybody. My name is Cary Gans, Dr. Cary Gans, and I'm a dentist. I practice in Garden City, New York, right across from Roosevelt Field Mall, across from the new Neiman Marcus. And I just had, I happened to be home today, and I normally record these in the office, but I wanted to talk a little bit about dental emergencies. Because there's some confusion as to what they are, what should be done, how are they handled, etc. So, and I just happen to be sitting here. I have all my calls sent to my cell phone. I used to use an answering service. They were terrible. I used years and years ago, I used a beeper. It definitely ages me. And that was terrible. And so now it's just much easier with the technology today. Just have all calls forwarded to my cell phone. So I get a fair number of dental emergencies, what we call dental emergencies during the day, on my days off, which is fine, which is why I do it. My patients know that I'm available 24/7 if should they ever have a problem. So anyway, I was sitting here today doing some work at the computer and got a couple of phone calls. And I think we should define what dental emergency are, what I believe is the appropriate way to handle them, etc. So a dental emergency really is anything that a patient feels is a dental emergency. That's what a dental emergency is. Now, in dentistry, we don't face life and death. What we're facing are lost temporary crowns, broken teeth, pain, infection, bleeding, sores, things of that nature. And once again, we really believe is if it's an emergency to our patient, it's an emergency to us. Who are we to define what an emergency is? Now, how we handle it is different. Depending on the extent of the emergency, depends upon how it's handled. Now, in every dental practice, it's done probably differently. If it occurs on a day off, we get in our car and we go to the office. I have a 13-year-old who tends to go with me. We travel together. I take care of whatever the emergency is, and then we go off and have breakfast or lunch together. So it's our way of making it a bit of an adventure, but at the same time, we take care of whatever the emergency is. Now, some emergencies obviously are more dire than others. If somebody's in pain, sometimes that can be handled over the phone, with medications or referrals. Sometimes a dentist can tell exactly what's going on just by the symptoms you provide, etc., or your past history, and can make a referral if it's something that needs to be done by an outside specialist, depending on what that dentist does or does not do in his or her own practice. But once again, some emergencies can be handled over the phone. Many emergencies cannot be handled over the phone. Broken teeth, lost temporary crowns. Just had a patient who actually swallowed her bridge. She went to another dentist, a specialist. Something was done. It loosened the bridge. She put it back on, probably not with enough cement, and she unfortunately swallowed it. That requires, unfortunately, trying to sift it out if it can be done. Or, we just lost you for a second there, or, sometimes an MRI or CT scan, whatever, is necessary to locate it, to see if it was passed or if it's lodged somewhere. That can be a life-threatening emergency. Now, we've over the years seen people not only, digest or eat, swallow a dental restoration, but we've actually seen patients who have inhaled them, where it can get stuck in the throat, can get stuck in the airway, etc., or in the lung, and that becomes extremely dangerous. So that's why emergencies should not be treated lightly. Patients should never hesitate calling the dentist. Our job is 24/7 now. That doesn't mean I want to be awakened at 2 o'clock in the morning for a temporary cap that comes loose. There's common sense to all of this. But if it's a life-threatening emergency, we should be called. We are physicians of the mouth. We're not just teeth fixers. Dentists are here to help you with your oral health, and being part of that is treating that as dental emergencies. So once again, the true emergencies are bleeding, pain, infection, things of that nature. Those are real emergencies. Those are something that's got to be taken care of right away. If you're bleeding, if you're in pain, that's something that needs to be treated immediately. And every dentist should be available to do that, whether they have office hours or not. Now, when we have office hours, our first comment is come in. You may have to sit for a few minutes, but the reality is come in and we'll take care of it. Nobody leaves my practice, leaves my office in pain with infection or bleeding. That just makes common sense. If it's something that requires more time, well, we may have to schedule it. But at no time should a patient hesitate to call. Dentists are here to make sure that your needs are taken care of. And once again, if it's an emergency to you, it's an emergency to us. And it's something we should be taking care of. That's really what I wanted to talk about, because patients very often are hesitant to call, and because they don't want to bother the dentist. I find that to be really unfortunate. I think that really comes from not wanting to call your physician because you don't want to bother him or her with your medical problem. Well, that's also ridiculous. I mean, that's why they're there. You know, physicians are there to take care of your overall health, and we as dentists are here to take care of your oral health. And we're on call to do that. So once again, I hope this makes sense, and I hope it'll at least stimulate some thought as to what should be done and how dental emergencies should be handled. Hi, Ralph. Good to see you. I'm good to Ralph. If you have any questions, I'll stay on for a few minutes. If anybody has a dental emergency or has a question about an emergency or any dental issue, I'm more than happy to answer it, because you can just put it at the comments. And I'd appreciate it if you'd share these videos, because it may help others. If you have I know you do have the ability to share them, so that would be great if you did so. And maybe other people have questions. Dental emergencies are things that should be taken care of and should not be treated lightly. So, Ralph, good to see you. And anybody have any questions about any dental emergency? And once again, pain, infection, and bleeding are the three big ones. Those are things that have got to be taken care of. All the other things, even a broken tooth, if you're not in pain, and if the edges aren't, cutting your tongue or your cheek, and if you can chew and function, that may or may not be a dental emergency for the dentist that you see. Once again, pain, bleeding, and infection are the three big guys. Other than that, everything else, for the most part, can be seen at a different time and may not require a separate office visit. But that should be up to you and your dentist. That should be something the two of you decide upon, and certainly make that phone call. I hope this makes sense. Dental emergencies. There's just one more thing. The overprescribing of drugs. We are now faced with a kind of dilemma in the health professions. We've been told by all the gurus out there that we're all overprescribing medication. So if your dentist is hesitant to prescribe opioids or any pain meds or even antibiotics because he or she is not, 100% sure they're required, please understand that. There are antibiotic-resistant bacteria that are coming into account that we have to worry about a little bit, and there's a huge epidemic with overuse and addiction to opioids. So dentists and physicians today are very, very cognizant of the problem and tend to go ahead and take a step back in prescribing medication where we don't believe it's necessary. So instead of Percodan or drugs of that kind, we may suggest one of the NSAIDs, Advil and all that those kind of drugs instead. And for the most part, they normally will satisfy the problem. So just be aware of that. It's something that's taking its toll. Plus the fact that we no longer can write prescription. Now everything is done by computer. So it makes it a little more cumbersome, a little more complicated to even write the prescription compared to what we did in the good old days. I hope everybody understands this. Once again, please share this so that others will see it. Once again, my name is Dr. Cary Gans. I'm here in Garden City, New York, across from Roosevelt Field. If you have any questions or have an emergency and you're local, call me at 516-741-1230. And let me put my, let's see if I really stand behind what I say. I'll be happy to talk to you and help you. Even if you're not here, be happy to give me a buzz. And we'll see if we can at least push you in the right direction. I hope you have a great day, and we'll be doing these pretty often, probably once a day, as long as I can think of something of importance. Or if a patient brings something up, that's typically why I do these little Facebook Lives, because a patient will say something to me. And it just stimulates a thought, and I just want to pass it on. It's a great venue, and it's a great way to do it. Have a great day. I hope everybody enjoys the weather where you are, and we'll see you next time on Facebook. Bye-bye.